Now, former chairperson of the Electoral Commission, Charlotte Osei, has been speaking, and she says the laws of the country must apply equally to all. Mrs. Osei says democracy is only strengthened when people are not treated differently when they fall foul of laid-down procedure. Now, the former EC boss was removed from office after reports of procurement breaches were made. There are some who believe her offences are not different from that of Health Minister Kweku Agyeman, who admitted to breaching the Constitution and procurement laws in a Sputnik V vaccine contract before a parliamentary committee. Now, earlier, she put out a tweet which seemed to refer to karma in the heat of the hashtag Agyeman must go campaign on Twitter, and she's been explaining the rationale behind that tweet on the Super Morning Show.
When you talk about karma, karma is the biblical equivalent would be what you sow is what you reap.
Exactly.
And we always look at it as if you sow corn, you would not reap beans. But we forget that if you sow one corn seed, you are not going to reap one seed. It grows into a plant, it produces a lot of fruit. So there's the principle of multiplication in everything that we do, and even our thoughts are seeds, our actions are seeds, and when you reap it, you reap in multiples. And that's why we should also be very careful how we manage certain situations, because this thing is like a roller coaster. That's just how life is. It's up and down, round and round. So we should be guided.
And in being guided, that seed that was planted years ago.
Well, we're all watching the harvest, aren't we?
We're watching the harvest.
I guess so.
What was the seed that was planted years ago?
Well, that's a book. Topic for another day, yes.
Topic for another day.
Yes.
Okay. Somebody wants to know whether, we're talking about Kweku Agyeman at the time, Health Minister.
You are, I'm not.
No, and we, including, I was part of it actually.
That's you.
Yes, we're discussing it, and then that tweet comes in because Kweku Agyeman.
A little mischief is good for the soul.
Oh, okay. Oh, okay.
Now, one of the cardinal principles of the rule of democracy is the rule of law. The rule of law simply means that every citizen should receive the same treatment. As soon as you start making distinctions in how you treat citizens, whether it's in the law court or before Parliament or in the court of public opinion, what happens is that the institutions start losing the trust of the people. And when they lose trust, they lose legitimacy. The rule of law must apply. We must treat all people the same. If the law is broken by Winston and we sanction Winston, when Kojo does the same thing, we must sanction Kojo. Otherwise, we're creating a system of inequality and injustice.
Someone will ask the question, so if we felt that Charlotte Osei violated procurement rules, how about Agyeman?
You have answered your own question. Next question, please.
That's the feeling you have?
I don't have any feeling. You answered the question. You asked and you answered.
So I'm asking you, that's the feeling, is that a feeling you have?
The public can judge that.
Let's go to the Ashanti region next, and the Johnson & Johnson vaccination exercise will come to an end today. On Friday, 50,400 doses were sent to the region to be distributed in 4 districts. Now, the district set up 36 centers where citizens were given the opportunity to access the jab. Love News' Ohiming Terrier has been following the process and is currently standing by with the Deputy Ashanti Regional Health Director, Dr. Roxanne Michael AJ. Hi, Ohiming, what are you learning?
It's been 5 days since the Johnson & Johnson vaccination exercise started in the Ashanti region. We are looking at 4 COVID-19 hotspot districts in the region where health officials say they contribute not less than 60% of weekly infections as far as COVID-19 is concerned. Kumasi, Metro, Oforikrom, Asokwa, Kwadaso are the other municipalities taking part in this exercise. Behind me is a KMA clinic center here in Kumasi Metro. we're finding out from health authorities how the exercise has gone so far. Let's speak to Dr. Roxanne Michael Ejay, the Deputy Director in charge of Public Health in the Ashanti region. So, Doctor, how has the exercise been going so far?
So far, it's been very good. Patronage is very high. And if we catalog from the weekend when we started, and the weekend it was a bit jerky for obvious reasons, because weekends people usually will not have time to come out for such exercise. But from the Monday, it's been very, very active. On average, we've been doing about 8,000 to 9,000 doses daily. That's 8,000 to 9,000 people are vaccinated every day. So as it stands now, we've done over 30,000. And though today's official date for completion of the vaccination exercise is likely to be extended to Friday, as long as we have vaccines. We have about 20,000 doses left. And I'm sure by the close of today, we've left about 10,000, looking at the rates of consumption within our region here.
There's this saying that last days are dangerous. Are we seeing this last day, rush in the COVID vaccination exercise?
There's not been any rush. The loads of people you see here, it's what pertained from Monday. As I said earlier on, the weekends was very calm. The weekend was very calm. But from Monday, it's been a bit turbulent in terms of numbers turning up. And since we left with some doses, and the message is also out there that we are going to run out of vaccine, we expect such clamor or such huge turnovers in our various centers. Quite are so called that they run out of vaccines, and that is all that they have. And they still have some people yet to be vaccinated. So we are trying to mobilize from other areas to be able to satisfy those who have come to queue since morning. So for them, it's likely to close today, because when the 300 people are done, they won't have any more vaccines. The other areas also have equally high number of people turning up to get vaccinated. So that is what we are doing. But we are limited by the number of doses we have, and that is about 50,400, what we receive from national.
It's been 5 days when you started this exercise. Is it not surprising that the 50,400 doses that the region received, we still have some backlog to be covered? That we still don't have people in the queues, so much that they will be ready to be vaccinated.
We have more people than vaccines now. Like I said, it's been 5 days. But the first 2 days, entered the weekend. People usually will not come out because of funeral, Ashanti region, funeral and other festivities will not make people take off their weekends for such exercise. But from the Monday, it's been very, very turbulent. People are all over, and from all the centers, they are always having people queuing up for the vaccine, which is why I'm saying that we're going to extend it a bit so far as we have vaccines. And we are not likely to extend beyond Friday, looking at the rate of consumption that we are doing on the average about 9,000 doses daily. I mean, if you take away what's happening over the weekends, which is extremely very low, from the weekdays, Monday up to yesterday, we knew an average of 9,000, and we have only 20,000 doses left. So if the rate should continue, it means that today, tomorrow, we'll be done with all the doses that we have received.
Let's look at the reaction of this Johnson & Johnson vaccine. Is it the same as the AstraZeneca, vaccine, or probably what has been the response from those who have participated in this exercise as far as the reactions are concerned?
So far, our surveillance system has received reports of only 3 adverse events. And that's not to say that is all, because the surveillance system we use is a bit passive, that it depends on you reporting either to the health care provider or going on the net or using the MedSafe app. And usually, the sensitization was high that people may experience some fever, headache from the vaccination, actually proving that your immune response or your immune system is actually being stimulated by the vaccine. So a lot more people will just want to take it easy, probably get some paracetamol to take and then sleep off because it's minor. But a few have reported, like I said, we've had a report of 3 since we started. 3 out of 30,000 doses.
I see. And what were the specific complaints that they brought to your outfit?
Oh, there were minor complaints, constitutional symptoms like headache, fever, bodily pains, which is not unexpected from the vaccine. The adverse events that are complained similar to what we experienced with Covishield some few weeks or few months ago.
What are the lessons to be learned as far as the Johnson & Johnson vaccination exercise is concerned going forward?
You know, the lessons first, let me start with the public, that it's always good not to wait for last minute. When we hear of the campaign, the very moment you hear, please go to the various centers and get vaccinated, because as the days run by, the place or the vaccination points become heated, because a lot of people want to catch up the last day or last vaccine doses that are left. And for us, the lesson we have learned is maybe moving forward, the next time we have campaign for a particular area, we may have to strategize about our communication, because some of the people are coming from other areas, though we may be able to turn away some of them by convincing them they understand, but some still demand, and beyond certain point, you can't push them away. So we still give. Maybe you have to look at how to communicate within the local settings, within the community, so that the people who are eligible for the vaccine, in terms of place, community, they can get the vaccine. Because now if we have more people coming from outside these hotspots, then really it tends to dilute the impact we want to have. Because when we're able to vaccinate the people staying within that hotspot, we are likely to bring down the infection.
Now, as you heard Dr. J say there, more than 30,000 people from 4 COVID-19 hotspot districts in the Ashanti region have been vaccinated in the ongoing Johnson & Johnson vaccination exercise. Health authorities say Kumasi Metro, Asokwa, Oforikrom and Kwadaso municipalities contribute over 60% of COVID-19 weekly infections in the Ashanti region. Now, Ohiming, you have Dr. Jima Omari Sasu, Metro Health Director of Kumasi, with you to explain why there's a long, winding queue.
Yes, the vaccination exercise is still happening here in the Ashanti region in 4 hotspot districts in the region. As far as COVID-19 is concerned, what we are seeing here is that the KMA Clinic Center is among the 36 centers designated for this particular exercise. Unlike other places, there's so much people, queued up here to be served for the vaccination exercise. There's a long winding queue as far as from the entrance of this particular building right to where we are now, and a lot more people are waiting to be served. Let me find out from Dr. Omari Sasu, the Metro Director for Health. How are you able to manage this whole long winding queue here?
Thank you very much. We have a number of teams working, doing the data entries, and this helps to make the line move faster. We have reassured everybody that those available here will get vaccines for today. So we are counseling them and giving them the education. It's likely we'll run out of the vaccines today. So today is the last day, mostly for Kumasi Metro, with the COVID-19 Johnson vaccine for today. We are very happy with the turnout, with the media and the education that has gone on from the NCC. They've helped us a lot with educating the community about the COVID-19 vaccine. COVID-19 is real, and we should all continue to observe the protocols. Thank you.
How do you ensure that all these people who have gathered here you don't mess up at the center. Yes, the numbers are huge. So how would you know that these are the people who came first and have to be served first? How do you manage the situation?
Okay, so we have a queue for the elderly. There are some who are the elderly. We make sure we have priority for the elderly. So we see them, the middle age and the younger ones can wait in the queue, and we follow the queue duly. So they make sure there's a team making sure that they follow the queue as it's at hand. If you are elderly, we give you a priority. We have a team who are managing the elderly who are coming to us.
Other centers, we learned people who have taken part in the the AstraZeneca exercise also turn up to be served. Is that the situation here?
A few came, we've cancelled them. So as you come, we give you those who are eligible. So if you are waiting for your second dose, this is not the time. We are reassured that very soon the second dose will also come on. So we've reassured them that they should wait. When the second dose for the AstraZeneca is in, we'll let them have it and inform them for them to come. So they've understood it. So those who are here are those who haven't taken any of the COVID-19 vaccine. We also do a case research in our app to make sure you have not taken the AstraZeneca before we make sure we give you the Johnson & Johnson vaccine. Thank you.
So Daniel, that is the Metro Health Director for Kumasi, Madam Omari Sasu, taking us through how they are able to manage these long winding queues at the vaccination center here. I must say it's a very long winding queue. If you look at the number of people who have gathered here, it's an indication that indeed the education, sensitization, asking people to take part in the exercise has gone down well. Just that health authorities say at the beginning of the exercise, the people were a bit reluctant to come for the vaccination exercise. But today the numbers we are seeing here are so huge. And I can tell you, those who have gathered here, they are men and women and elderly who also have a different queue. That's the arrangement put together by health authorities. The arrangement is that once you are here and you've been counted and given a number, definitely you'll be served. The health director did indicate that probably after today, with the KMA, especially at the KMA clinic here, the exercise could come to an end. But at the regional level, we are told there are about 20,000 doses to be given to people who need them in the region. But beyond what we are seeing in the queue here, the queue is very long here. It goes beyond what I can even imagine. There are people who have gathered here, and I'm not too sure how eager they are as far as this exercise is concerned. Let me find out from the big man here. Chief, good morning.
Good morning, boss.
How long have you been here?
6:30 and 7 o'clock.
Oh, what about Habesa no past 6:30? And now 7.
6:30.
What about 7 more? Now, what baby a woody? I went in that so say bedroom so and son wako.
Yashiyame. Yashiyame. Yachaya watching. To some case, Omapwa, Yenia Samka, Yabacho, Dafu for Yaba.
So this is somebody who has been here since 6:30 a.m. And he says he's been waiting. Once he's here and he's been assured that he'll be served, then he's encouraged to still wait. If you look at beyond this queue, beyond the walls of the clinic, there are people who have also queued up, and they are just almost on the roadside. So it's an indication that the numbers are very, very huge here at the KMA clinic. So let me find out from some of the people who are anxiously waiting to be served in this queue. Chief, good morning.
Good morning.
Pacho, over Hache.
Maybe 6 o'clock.
Over 6 o'clock. Pacho, if I know if you buy.
If you're team, Master never.
I don't know if you're to Kumasi, Bewo Panye, or Kumasi.
Stations are more bino, a hundred bemi. Until them I'm Bahano.
Now, what he said, Pennyphone can say, Panye drew her. Baby out here, and one about Panya, and that's a weird Juma or her, or ball Panya, what's here to meet him. What Chamu, and Grupombe say, me and son, Wabahay, and our Panya. What is and Carbono?
Oh, man, shut down test about it. Means if you will be at me one. Na Miss Hunsa Hametaba Kurum to me Bahan Mawane Preko.
Okay, so Daniel, this is just an example of what the Deputy Regional Health Director talked about. There are people who are not in Kumasi Metro or within the 4 designated districts, but have decided to come and then take part in the exercise. This particular man came all the way from the Fijako-Abre South District. And when we talk about Fijako-Abre South District, it goes beyond Tafo. Even Tafo is not taking part in the exercise, but he decided to come all the way from this place to come and have the exercise or undertake to take part in the exercise. So that is an example of what the health director actually talked about. Let me say we are getting to the latter part of the queue, and all these people are just waiting to be served. If you look at the distance, we are looking at over 1 kilometer. So all these people are 1 kilometer away from where the vaccination exercise is currently happening. But they are not perturbed. They are very hopeful that indeed they will have the opportunity and the chance to be vaccinated. Let's go out and then talk to the people who are outside the walls of this clinic. Yes. So we are moving outside the clinic, the vaccination center here, to speak to the people who are already in queue here. It's a long, winding queue, very long, winding queue. Chief, good morning. He says we should move to the next person. Let's see. Yes. So we are doing almost 2 kilometers from the main vaccination center here. And all these people you see here are in the queue. I'm sure these women are tired and they are taking some rest down here so that they get the opportunity to be vaccinated. I will say, I don't know here.
But I did lie.
Would you lie? That's like you say, would you lie? Yeah, lie and the way now so here.
Me now this time and I am here. To me, engine house, I'm tired.
What would you have said? Don't you be saying?
Oh, you drew Anna as 740. I'm drew.
Oh, okay. So this woman tells me she's actually in the queue, but because she lacks the capacity, the strength to stand in the queue, then she decided to come and take some rest here. So if you look at where she is, she's not the only person here. The others who are in the queue and feel that they don't have the strength to carry on again, so they have to sit down here to take some rest. I must say it's a very long winding queue. We are talking about 2 kilometers away from the main vaccination center here. So we are seeing people standing here. It's almost closer to the KMA circuit court here. And these people are still here. They are still here. And they are still here. Mommy, would you say do never do so?
Ah, yes, sure. Yeah, her son said, yeah, do this yes, and then last day. It's here, her say, bet me a do your swat.
About how, what the best don't hear say?
Oh, me by the ancient meeting call Matter Day Hospital. And I may call Dr. Anna Horn, I said one or more year. It's more than I'm said there be as a nippon dogs into member and I may measure. See, Nisha, say bedroom is so.
By Abamu, say, we share queue, wapa.
Abamu cry. A room is so, a room is so, a coffee.
And the Miado was sent our coy and son over high.
And be a mune. Me call Matter Day. And I'm making call Dr. Anna Ho. And I'm before me bad Matter Day. Dr. Anna no, yes, no, on Bay. See, almost and no mamma, haunt memra, sinterest, no me call Matter Day. To me, through on a Masaba and Missy.
So, baby, I won't pany. What's your so and I say, Uti, Kumasi,
Greek. Metia Greek. And I'm a baby, had Missy. It's Madame Lollifer from her.
She came all the way from Kwadaso Municipal to take part in the exercise here. Apparently, she's been moving to centers after centers. Now, she's moved to 2 centers already. And when she learns the centers or have been closed, then she has to come down to the Kumasi Metropolitan Assembly Clinic here. But she appears to be the very last person in this queue. Oh, we have 3 more people who have just joined the queue. So it means that she's not the only person or the last person in this queue. And so I must say, Daniel, people are here. There are people who have moved from other districts to these vaccination centers in order to be vaccinated.
Many thanks, Ohime Teria, for those updates. It seems to be a very, very long queue. A lot of people are eager to get vaccinated, and that is an encouraging sign in itself. I see someone rubbing off, and he's rubbing his arm. He seems to be in pain. I don't know if he just got his shot. Anyway, Ohime Teria there, coming to us live from Kumasi. Let's turn our attention away from COVID-19 vaccines. And President Akufo-Addo says he will position Ghana as the center of excellence for medical care in West Africa by the year 2030. He says this will be achieved by mapping various regional health facilities for specialization and investment in healthcare infrastructure. The president was speaking at a ceremony to start the construction of hospitals promised last year. Nana Ojima has more.
According to the president, research has revealed $6 billion was invested in seeking medical services abroad by Africans in 2016. Nigerians alone spent $1 billion of the amount. The population of West Africa is projected to reach 500 million by 2030. President Akufo-Addo believes medical care delivery holds great economic potential.
The goal is thus to position Ghana as an attractive medical destination with excellent medical facilities for our neighbors to patronize. Several countries have benefited from international medical travel. Benefits to these countries include enhanced GDP growth, improved healthcare infrastructure, foreign direct investments, tourism promotion, and importantly, halting the brain drain of skilled medical professionals. In order to take advantage of the huge potential for medical travel, we began during my first term in office a program to revitalize healthcare infrastructure in our premier hospitals. Investments were made in the Kolebu Teaching Hospital in Accra to build a new 400-bed maternity and gynecology block and a new 100-bed urology and nephrology center of excellence. Government will build on this foundation and include 2 additional projects currently in the planning stage, namely the Trauma and Acute Pain Center and a new surgical service block with modern inpatient facilities.
The president says a corresponding investment will be made in education to achieve the target.
Whilst we upgrade facilities, we should invest in medical education and training of our health personnel, including expanding the use of IT for medical diagnosis and treatment in the Agenda 111 healthcare facilities being developed. This network of primary, secondary, and tertiary healthcare facilities will form the backbone of the vision to make Ghana the leading healthcare destination in West Africa.
88 sites have been identified for the Agenda 111, with work commencing at all sites from August 17, as efforts are being made to secure other sites. An amount of $16 million is needed for each of the healthcare facilities. Minister for Health, Kwaku Agyeman-Manu, gave an update on COVID-19 treatment centers.
Works are currently also ongoing at the Kumasi Treatment Center at Sewa, at the Kulindebota region, Zebila in the Upper East region, Sevia Sawenso in the Western North, and Kolebu in Accra. Other sites are Sunyani, Takoradi, Nalerigu, and Cape Coast. Excellency, all these treatment centers have got financial coverage, and we have promised to complete these in good time for our use.
Meanwhile, Asantehene's representative reiterated public concerns in government's commitment in seeing through the project execution. Nana Achenakweja V wants the president to see these projects as legacies of his stewardship.
Ghana for Jiwachinye. Untumenya Sekumawudia, Untumente on Sanfrey home. Omana dear, Unye, Aferi. Social media and the Chinebe Bray. And so, Sanya Obasra, Tumfor, Kachira Wano. Tumfor, Awa Reshemusa, Ubetmia, na the Bruni, a friend, say legacy.
For Joy News, Nana Ojima, Kumasi.
Now, 772 farms belonging to 1,605 farmers were destroyed in last Thursday's flood in the Upper West region. That's according to an assessment by the National Disaster Management Organization, NADMO. NADMO also says 336 people have also been displaced. Upper West Regional Director of NADMO, Ahmed Mustafa, has been speaking with correspondent Rafiq Salam.
It is a regional crisis of monumental proportion, ballooned to a national level, and the country's president sent one of his top ministers to console and sympathize with chiefs and people of the region.
In the midst of all these regrettable incidents, he is at least happy that no life has been lost. He is saying so because life, when lost, cannot be regained.
Kwesi Amankwata assured the chiefs and people of the region of fixing the roads in record time.
No matter the extent of the devastation, no matter the extent of the destruction of the road network, that is within human capabilities, that is within the powers of his government, and that all roads that have been destroyed and bridges destroyed would be reconstructed in a record time.
In PNW Ghanem, they found a reliable partner who constructed more than 80% of the roads in the region, including those destroyed by the flash floods.
Our engineers have been on site. They are doing a lot of work. They are taking inventories. And by the end of the week, by Friday, before Monday, we would have known exactly what should be done to reconstruct the roads, to reconnect all areas that have been separated from the rest of the region.
It's been 5 days since the floods occurred in the Upper West region, and the National Disaster Management Organization, NADMO, led by its Upper West Regional Director, Ahmed Mustafa, has finally been able to make initial assessment of the situation.
722 farmlands have actually been washed away of what happened on Friday, and the total number of farmers of this acres stood at 1,605, and we have some houses that were actually collapsed, and the total number of households that have actually collapsed is 80 of them, and individual being displaced so far as this flood is concerned is 336.
You're live on Joy News Desk with me, Daniel Daze. Up next is Daryl Kwao with business.
Hello, welcome to business. My name is Daryl Kwao. Port operators are demanding more powers to be given to the Ghana Shippers Authority to go after shipping lines flouting the laws of the country. This will make doing business at the ports easier, according to them. Deliberating on the impact of free charges and demurrages, President of the Ghana Union of Traders Association, Dr. Joseph Obeng, said more work needs to be done to strengthen the Ghana Shippers Authority to regulate the activities of ship owners and shipping lines.
Going now, I don't think the Ghana Shippers Authority can control them. Most times they do their best to give directives as to what these shipping lines should do, but they do not go by it. It means that maybe there's no law to bite the whole thing. That's why we are calling for stringent measures or laws that will make sure that we have some control. It should not be said that we left them uncontrolled for them to just extort whatever they want from the consuming public, for the importers as well as the consuming public.
Now, the recent banking sector reforms exposed the need for quality human resource in the area. Now, the rural and commercial banking space was one that was sped the shake-up during the period. So to strengthen the sector, Amefima Rural Bank, for instance, has stepped up initiatives to become a net exporter of quality human resource for the financial services sector. It has initiated an employee talent development program where beneficiaries undergo a 2-year professional training to get upgraded on the job. Prince Apia was at the graduation of the second cohort of the program and filed this report.
The Talent Management Program identifies talents, develops them with the competencies and skills required to drive business strategies. Launched in 2015, 2 sets of cohorts with more than 40 persons have already graduated from the program. Dr. Alex Asma is the CEO of Amefima Rural Bank.
The aim of the whole talent management program was to identify talent within the bank, develop them with the competencies, the skills, the knowledge, and the aptitudes that is required to drive the strategy and the vision of the bank. We want to ensure that in the future, from now going, we don't fill top and middle leadership roles from the outside.
Amefima Rural Bank partnered the China Euro Business School to run the second cohort of the 2-year program in Accra. Dr. Asma says the initiative will enhance the quality of human resource in the banking industry in Ghana.
This is a good strategy for the bank because to us, our asset is not the cash we have, our asset is not the investment we have, our asset is not the vehicles and the beautiful buildings we have. Our best and most important assets are our people. So we continue to invest in the people to make them better than they came, and that's what we'll be taking pride of. So we want to develop people, not only for the rural bank industry, for the larger financial services industry.
And that's your business update. Sports is coming up next. Meantime, more news on our website, myjoyonline.com/business.